Hi, my name is Kalie Day, and I'm a student at the FSCJ Nursing School, and today I'm going to be showing you how to administer IV medication. So the first thing you want to do before you drop anything is to check your MAR and check the 5 rights of medication. So you want the right dose, the right medication, the client's name, the time, and the route of the medication. So now that you've checked all that out, you can go ahead and draw up your medication. Today we're going to be drawing up 2 milliliters of Flagyl. So you clean the top, you pull back and draw up 2 milliliters of air. You inject the air into the medicine. And then you draw up your 2 milliliters.
And then I'm going to apply my gloves.
Okay, now that you have drawn up your medicine, you can go ahead and dilute it into the bag. So you take the top off, stick your needle in, insert the medication, put this in your sharps container, and then you lightly agitate the bag to mix up the medicine. Now the next thing you're going to want to do is put the label onto the bag, and on the medication label you have the client's name, the drug, the dose, the time, and your initials. You also want to calculate the flow rate and the drop rate. So let's say the drop rate is going to be 15 drops per minute. So now that you have this, you can go ahead and spike your bag. So to spike your bag, you take off your little cap, you just stick that in there. Alright, and hopefully you have an IV pole near you because you want to hang this above your head because we're going to prime the tubing.
And pull the skin taut.
So you want to prime your drip chamber, and then you want it about halfway full.
Tell the patient
and then when you have that done, you can slowly
level up 15 degrees.
unclamp.
And then wait for...
You can see it's dripping and all the air bubbles are going out of the tube. So once you have all the air bubbles out of the tube, you can clamp it again. And then you want to put an alligator clamp on it. And now you're ready to go to the patient's room. So you walk in, knock, knock, knock. Hi, Mr. Johnson. I'm Kalie, your nurse today. The doctor has ordered administration of IV medication. So you wash your hands. You put on your gloves. Now, once again, you check him for, you ask him his name, you ask him his date of birth, and if he knows where he is, to identify the patient and make sure you're not giving him just totally wrong medication. So before we actually insert the medication, we're going to check the area, make sure it's not infiltrating or red or anything. This one looks good. So I have my 6 milliliters of normal saline that we're going to flush with. So first, you take your alcohol swab. You clean the needleless ports and then inject this. And then you aspirate a little bit, get some blood return so that makes sure that you're in the vein still. And then you inject your 3 milliliters. So now that you're done with that, you take that off.
If it's in the vein, it's not going to resist.
And now you can actually inject the medicine because you're sure that you're in the vein and it's still patent. So you take off your old alligator clamp and you put on your new one. You get a new alcohol swab. Clean the port again. And then put the alligator clamp onto the needleless port. Now you can unclamp the medication. Make sure it's dripping like it's supposed to at the amount of drips per minute that it's supposed to.
The guy again?
So while that medication's running through, you can go ahead and put your label on your tube. Just make like a little flag. And on this label it would say the date, the time, and your initials, so the next nurse who comes in knows how old the tube is. So once you've administered all the medication, you can go ahead and take this off, and you want to get yet another new alligator clamp. Put that up here, and then you can hang that up here.
not making sure not to
So we're
cover
going
the,
to clean the port yet again.
cover the thingy.
And then we're gonna flush with our remaining 3 milliliters of normal saline so that we get all the medication out of the INT. So you go ahead and do that. And then you would also flush with your clean and then flush with heparin if that was ordered. So on my end documentation, I would do it on my MAR. I would put in the dose, the drug, the time, and the route. I would put on the condition of the IV site and the IV. I would document the volume of medication that I delivered on the intake and output sheet. That's it.